Have you ever been told an antidepressant would simply make you feel better, only to find yourself numb, agitated, or wondering why quitting feels impossible?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're examining what you're rarely told about SSRI and SNRI antidepressants, the frequency of side effects, the reality of withdrawal, and the serious risks that have too often been minimized or dismissed.
I'm Alara Sky. Our aim is to lay out clear facts drawn from reported data and patient experiences. You'll hear what percentages people actually report for sexual dysfunction, emotional blunting, agitation, and how often withdrawals strike when you try to stop.
When you hear that only a minority of patients benefit, it reframes the everyday prescribing you see around you. SSRIs are widely promoted, yet surveys show many users don't feel like themselves, feel emotionally numb, or experience agitation. In one survey of 1,829 antidepressant users, 62% reported sexual difficulties, 60% felt emotionally numb, 52% felt not like themselves, 47% experienced agitation, and 39% cared less about others. Many also said they were not warned these effects could happen.
You're also not told how shaky some of the approval-era data was. Early trials for drugs like Prozac faced serious problems, and equal dropout rates between drug and placebo groups point to benefits that did not outweigh side effects for many participants. In a review of Paxil trials, 77% more people on the drug stopped due to side effects, and 155% more stopped because of suicidal tendencies compared to placebo. That matches what a lot of you notice in real life. People often choose to stop taking these drugs.
What's often minimized is violent agitation and suicidality. Label warnings list anxiety, agitation, hostility, impulsivity, akathisia, hypomania, and mania. Effects also seen with stimulant street drugs. A Cochrane review has linked SSRIs to a doubled risk of suicide, and even short studies in healthy volunteers have documented suicidal states. These are not theoretical concerns when you or someone close to you begins to change in alarming ways after a dose change.
Another pattern you may have seen is a slide into bipolar diagnoses after antidepressant exposure. Records reviewed at Yale linked SSRI use to tripling the annual rate at which patients became bipolar. Surveys report that a large fraction of people diagnosed with bipolar disorder developed it after receiving SSRIs for depression. Hospital data also describe mania and psychosis emerging after antidepressant starts, sometimes with command hallucinations to self-harm. The practical point for you is recognition. New agitation, sleeplessness, pressured energy, or psychotic features after starting or adjusting an SSRI is a red flag.
Sexual dysfunction is both common and underdisclosed. A Spanish study of 5 widely used SSRIs found sexual disturbances in 59% of 1,022 previously normal patients. 57% decreased libido, 57% delayed orgasm or ejaculation, 46% no orgasm or ejaculation, and 31% erectile dysfunction or decreased lubrication. People consistently report that they were not warned, and some describe persistent problems even after stopping.
If you're pregnant or planning to be, the risks to infants matter. Data link SSRI exposure to more premature births, higher rates of septal heart defects, rising from about 0.5% to 0.9% with one SSRI and to 2.1% with 2 or more in one large cohort, and an increased risk of persistent pulmonary hypertension in newborns, with studies reporting elevations from roughly 2.5-fold up to over 6-fold. Irritability, tremor, hypertonia, sleep, or breastfeeding difficulties, and reduced early growth have also been reported in exposed newborns.
Now to the issue many of you encounter firsthand, withdrawal. Roughly half of SSRI users are affected when they try to stop. A meta-analysis found that 56% experience withdrawals, 46% categorize them as severe, and they can last for weeks to months. Symptoms range from brain zaps, dizziness, visual problems, surging anxiety, sleep disruption, rapid mood swings, derealization, concentration problems, queasiness, akathisia, and muscle pain or spasms, to escalations that can precede violent or suicidal behavior. These reactions often flare with even small dose changes.
What makes this worse is misinterpretation. You may be told that withdrawals prove your underlying illness requires ongoing medication, rather than that your brain is destabilizing from the drug. That belief can pile on more prescriptions to manage the consequences of the first one, and it can set up years of cycling through side effects and dose adjustments without acknowledging the root problem.
You also deserve to know how often people quietly vote with their feet. Large cohorts show early discontinuation is common. Many are unsure they ever needed the drug. Others stop permanently because of side effects. When you look at those patterns together with the withdrawal data, it becomes clear why so many users feel trapped once they start.
None of this erases that a subset of patients does report benefit. The point is transparency and informed choice. If you're never told about sexual dysfunction, emotional blunting, agitation, suicidality, neonatal risks, or the likelihood of difficult withdrawals, you can't weigh benefits against harms for your own life.
This conversation is also about culture. For years, public messaging pushed the idea that normal emotions reflected a chemical imbalance needing lifelong medication, and that questioning this narrative was irresponsible. Meanwhile, significant adverse effects were minimized, and reports of violent or suicidal outcomes were brushed aside or attributed to pre-existing illness.
You can change that by bringing these issues into the open. When you hear a friend say they feel not like themselves, or a family member describes numbness, agitation, or disturbing thoughts after a dose change, you can recognize the pattern and validate that this is known to happen. Awareness does not fix everything, but it prevents isolation and can prevent escalation.
If you've lived through these effects, your experience matters. People who read others' stories often realize it's the same story, and the disbelief that no one warned you begins to lift. That realization can be the first step towards safer decisions and towards seeking out resources that address the realities of withdrawal and adverse reactions.
Here's today's challenge. Take 10 minutes to write a simple timeline of when you started, adjusted, or stopped an SSRI or SNRI, and list any changes you noticed in mood, sleep, sexuality, agitation, or physical sensations around those dates. Share that timeline with someone you trust and begin an open conversation about what you experienced and what you now know.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.